Hi, everyone. Thank you so much for taking the time to speak with us today. We're here with Why We Vaccinate, a nonprofit organization dedicated to providing scientific information about the value of vaccines and also combating myths and disinformation. We're here with three incredible physicians who've spent their careers in the trenches of public health, particularly fighting with infectious diseases and working on communicating science with compassion. Let's start with some brief introductions. Could each of you share a bit about who you are and what brought you to this work? Perhaps we'll start with Dr. Luber.
Uh, my name's Stephen Luber. I went to the University of California, San Francisco Medical School and did my residency there in pediatrics. I'm a board certified pediatrician and a fellow of the American Academy of Pediatrics. I trained a long time ago, and we saw back then a lot of infectious diseases that fortunately we don't have to deal with today because of vaccinations. But it was a good tutorial. I then went to Central Idaho, where I was literally the only pediatrician for 100 miles in any direction. So I got referred a lot of very sick children and got to deal with sick children and complications, and frankly, a lot of illnesses that we don't see today because of vaccination. After 18 years of being on call 24/7, I moved to the University of Washington and taught pediatrics in the WWAMI program and began doing a lot of clinical trials. And as such, I performed over 60 clinical trials in the areas of infectious diseases, including most of the common vaccinations, and timely, including the MMR and the MMRV and recalibration of the MMR. That was done in 2010. I had just recently retired. I've been doing public health volunteer work, which includes vaccinations. I'm very concerned about the dismantling of our public health system at the current time and the emergence of popular choice as opposed to universal vaccination.
Thank you so much, Dr. Luber. And we appreciate that color. Dr. Miller?
Thanks. Yeah, I'm Mike Miller, and I've spent most of my career actually doing health policy, communications, and advocacy. Most of that in Washington, D.C., where I worked in the Reagan-Bush White House, the NIH, the United States Senate, Congress, big biopharma companies, and over the years, my work has evolved to be more around with working with patient advocacy groups and other kind of clinician groups and community groups. And the common theme has been trying to promote awareness, understanding of access, affordability, and particularly innovation. And throughout that, I've been involved with trying to communicate information about health and science to non-experts, the lay public, which by definition legislatures and policy people in Washington often are. And during the pandemic, I joined the board of Why We Vax at the beginning of the pandemic. I continue to manage their SAB and have really focused the last 5 years on vaccine misinformation and confidence, and wrote a book earlier this year, which we'll talk about a little later, I hope. On to you, Vivian.
Great, thank you. Appreciate this opportunity to be here. My name is Vivian Huang. I'm a dual trained physician. I am trained in internal medicine and public health. For the last close to 20 years, I've done mainly work in public health, and my specialties really and my passion lie in vaccinations. I have spent time working as a physician for Doctors Without Borders and also Partners in Health. I responded to the 2015 Ebola outbreak, which still is the largest Ebola outbreak on record. And while I was there was a measles outbreak. I have also spent time working for Doctors Without Borders in Syria, and we also carried out large vaccination campaigns in Syria during the civil war there. Throughout most of my life, vaccinations have been really an important part, not only of my professional career, but also my personal life, and which we will probably get into a little bit more during this conversation. I'm a strong advocate of vaccinations and prevention, and will continue to advocate for vaccinations. I currently work for a vaccine company, and I'm the medical director for flu and COVID vaccines. So great to be here. Thank you.